Namaste, namaste to all, and cordial welcome to the 81st episode of GURUBODHA. Cordial welcome to Dr. Rajnikant Patel. He is a well-known physician, Siddhahasta, we can call it as, has plenty of success in many cases that he has been handling. He is a chief Ayurveda consultant at Agnivesh Ayurveda Hospital. You can see his hospital's name with the logo there. He will be presenting on management of spider bite in Ayurveda. So with a case study, we may think that a spider bite, a small insect bite, how does it even matter? Things get complicated when the symptoms becomes out of reach of the medical system, and also they set up a big set of complications and make the patient's life miserable, be it a spider or insect, whatever it is there. So it is very difficult to treat such conditions. So here is one case presentation regarding spider bite and its Ayurveda management, successful Ayurveda management, along with the case study. All over to you, Dr. Rajnikant Patel. Start presenting your case, and also kindly let us know what is spider bite, Luta Visha, and how did you manage those cases in your own way. So all the way to you, Dr. Rajnikant.
Management of spider bite in Ayurveda, a case study. Luta Vish. Luta Vish is called as spider bite in Ayurveda. In this photo, you are able to see the spider. This is the actual spider which bite this patient. About the case which I am sharing, you can see the thorns in his leg. This spider, you observe the side leg, you can observe the thorns. It was a big size, like this much size spider was there. Thousands of years of human observation and trial and error is far more greater than the 6 months of rat experiments in the lab. So we should respect our Samhita and Shastra. The reason why I have to put this slide is we normally don't take it seriously our Samhita, but we take very seriously to the latest research. We read all the research paper, we read all the data published by modern science, but we fail to read our Samhita and Shastra. We should keep in mind that all the research data or published study which are published nowadays are studied on very limited people or on limited timeline. But when you see our Samhita and Shastra, our Acharya has seen thousands of patients, they have observed thousands of patients, they have trial and error, and and after that they have written the Samhita. So without any doubt or without any confusion, we must respect our Samhita and we should read it and we should apply it in our patient. Okay, coming to the topic, Charak Chikitsa, in Charak Chikitsa Sthana 23rd chapter is Visha Chikitsa. The whole chapter is dedicated to the poison, how to manage poison, how to identify poisonous snake, non-poisonous snake, spider, scorpion, etc. We will be dealing with only spider bite in this session. So Charaka has mentioned that Damsasya Madhya Yat Krushnam Shavamba Jhalaka Avrutam Dagda Akruti Brusham Paki Kled Shotha Jara Angitam Dooshivishari Bihi Luta Vistam Dastamiti Nirdeshak. So I have got this patient which has all the similar features which Charaka has explained. All the 100% features which were I was able to see in this patient. You can see the whole lesion is like a vein-like net. Patient was burning complaint. It was inflammation was also there. You can see the biceps muscles is a whole swollen muscle. You can see, and also fever was. So it is a clear-cut case of Luta Visha according to Ayurveda. And patient also had a history that he has found the spider in his shop, and after this only this thing has started. You can observe the patient's hand and what Charaka has written in his Chikitsa Sthana in under Vish Chikitsa. This was a boy, 23-year male patient. He came with a complaint of hard swelling in the right arm area with a severe burning sensation. It was very hard to touch that area with pain. Reddish discoloration in the affected part, and we can also see the reddish line-like appearance. So this is since 1 week. Patient was operated for the same condition in same hand at different site, and it is recurred for third time. In past, patient had exact similar clinical appearance in the past, which was operated for twice. First time he has this condition in this area. So they have operated this side. After few days, the effect of this poison came to this side. So this side, when this they have operated, first operation this side they have done, second operation here they have done. After these two operation, the effect of poison is now visible into this biceps. So that after that patient came to Ayurveda because they don't want third surgery. So this is the first time. This is the discharge summary when the patient was operated for the first time. You can see the diagnosis is right side forearm cellulitis with superficial thrombophlebitis. So for this they have operated for first time. This is for second time. You can see in diagnosis they have written as recurrent right forearm cellulitis. You can see they haven't mentioned spider bite or any insect bite in the diagnosis. The reason is they were not sure about this is the spider bite or not. It is not a spider bite, but all the history of patient is pakka evidence that he is having spider bite. So the past history we can in 13th of February the MRI was done. It shows that forearm cellulitis with subcutaneous infective collection on dorsal aspect, and for this on after 2 days of MRI they have underwent for surgery. On 22nd of March it again reoccurred in the forearm. So the MRI again saw that it has subcutaneous edema with inflammatory fluid involving deep subcutaneous plane of forearm region, particularly along posterior medial aspect. For this also surgery was done after 3 days of this MRI, that is 25th of March. So after doing two surgery, the symptoms is again now reoccurred in the same hand, but in the upward side. Since 7 days, the same symptoms has occurred and patient came to Ayurveda. So patient came for Ayurveda treatment as he doesn't want to go for surgery for the third time. Interesting to note that modern doctor tried to find out cause, but they couldn't find any cause for this issue. They have done culture and sensitivity of the cause, but the surgeon who was doing the dressing for his hand after this operation has an opinion that the dead tissue under the skin is clearly resembling like a case of any insect bite. We are not sure that these are the caused by either this spider bite or some another bite, but they were pakka sure that this is the case of any insect bite because the tissue when they operated and they opened the wound, they have find the exact similar tissue which is visible in the any insect bite case. Another interesting point here is that patient had seen a big size spider with thorn on his leg in his shop. He is not sure that spider is big bite him or not. The spider is not known to be present in Gujarat state. So all the data about the spider, patient's relative had sent to the USA to some expert, and what they say is the patient, whatever the condition patient is facing, that is pakka due to the this spider bite. And also interesting to note that the spider which was seen in his shop is not a local this spider in the Gujarat state. The patient, the chances are there that the spider would have come from China in container from where he orders the material for embroidery work on routine basis. In Surat, most of the people work in cloth related businesses. So this patient is also having a shop. He ordered some material to be stick on saris from China, container and container. So chances are there he might get this spider in that container from China by mistake, and in shop he has find this spider, and by mistake he has touched somewhere. So these are the brief history about the patient. One more interesting point to note that Acharya Charaka has mentioned exactly same symptoms in Luta Visha, that is a spider poison. Same thing I have explained in earlier slide. Based on this finding, 7 days treatment, all lesion and all the symptoms were 100% healed. In 7 days of this treatment, see, they have operated for twice in 2 months. Still, problem was not solving. But within 7 days of Ayurvedic treatment, all the swelling, inflammation, this discoloration, this that net-like structure on his arm, all disappeared within 7 days, and patient has stopped medicine taking after 7 days because he was completely healed. Now, see the treatment here. I have used eight different modality of the treatment. All eight treatments are from Charak Samhita. Classical treatment I have done. First one is Panchashireesha Gritha, that was given thrice a day, 1 tablespoon thrice a day. Second one is Shothagna Maha tablet. This 5 tablets thrice a day, 15 tablets in a day. Vishagna Maha 5 tablets thrice a day. That is also 15 tablets in a day. Kaishora Guggulu, that is 2 tablets twice a day. That for total 6 tablets in a day. Another is Dooshivishari Gulika, that is 3 tablets thrice a day. Total 9 tablets in a day. It is very important. Fresh juice of chilies flower 1 tablespoon every 2 hourly. Next one is we have given smoke, medicated smoke, which consists of herbs of tagar, kush, and chilies flower. This also we have given for thrice a day. In this medicated group, we have also added Panchashireesha ghee while preparing the group to fortify its effect. And to apply the paste on that local area, we have made a paste of chandan, rakta chandan, shirish seed, shirish bead, nirgundi, vidarikan, tagar, kush, patala, and anantamul. So all this powder is taken and fresh paste was prepared with the fresh juice of Sleshmataka leaf. So now the question must arise in all your mind that why I have given this much aggressive treatment and this much high dose, like punch 3 tablespoon in a day, Shothagna Maha Kashaya 15 tablets in a day, Vishagna Maha Kashaya 15 tablet in a day, Kaishora Guggulu 6 tablet in a day, Dooshivishari 9 tablet in a day. The reason behind why I have used this much aggressive dose in this patient is if within 2 or 3 days, if we were not able to see the results, then they were planning for the operation. So we can see is a loading dose. For 7 days, we have given loading dose, and within second to third day, patient started observing. We might not get the result if we have given a low dose of medicine. Maybe Shothagna Mahakashaya 2 tablet twice a day, Vishagna Mahakashaya 2 tablet twice a day. This might not work for patient. If within 3, 4, 5 days, patient is not getting improved with our Ayurvedic treatment, then they are ready to go for operation. So my aim was to save patient from operation, because if they are doing operation for this area for third time, I am sure fourth time this poison will move forward. So just to save the patient, we have give the loading dose of all the medicine just to get the results in second or third day. So now we will be going in detail about this all 8 treatment modalities. Panchashireesha ghee, the same Acharya Charaka has mentioned this ghee in this Visha Chikitsa Adhyaya Chikitsa Sthana. It is a simple preparation. All the 5 parts of Shireesha herb, that is a root, fruit, bark, flower, and leaf of Sireesha. So this is the botanical name Albizia lembac, this Sireesha botanical name. All this taken together in equal quantity is known as Panchashireesha Agatha, which is the best one for destroying any kind of poison. I have prepared this Panchashireesha ghee last year, big batch, and I am using this Panchashireesha ghee in all the patients where I suspect poisonous effect is there. Let it be animal, this insect bite or is there, or either it will be Dooshivishari or Garvisha. In all kind of Visha, we can use Panchashireesha ghee, because Shireesha is Charaka has told Shireesha is the best to use in any kind of poisonous condition. So Shothagna Mahakasha 15 tablets in a day I have given to this patient. This again mentioned in Charak Samhita Sutra Sthana under 50 Mahakashaya. The Shothagna Mahakashaya are the group of 10 herbs which is used to relieve the inflammation, or which is used to relieve the swelling. So what are these 10 herbs? This is Patala, Agniman, Shonaka, Bilva, Kachmaria, Kantakari, Bruhati, Shalparni, Krishnaparni, and Bokshuda. All these 10 herbs powder should be taken together, and after adding some this binding agent, we have made a pills, 250 mg pills. That is 5 tablets twice a day we have given to this patient. So this has worked to reduce the inflammation or reduce the swelling in this arm area. Next one is Vishagna Mahakashaya. So these are the group of 10 herbs mentioned in Charak Samhita Sutra Sthana under 50 Mahakashaya. So this combination of these 10 herbs is best to be used in any kind of poisonous conditions. Let it be animal poison, or it may be artificial poison, Garvish, Dooshivishari, like we are using preservative and coloring agent in a food. So this is a must to give majority of the patient. So Haridra, Manjista, Suvaha, Sukshma Ela, that is Elaichi, Palindi, Chandan, Katakasi, Shirish, Sindhuvari, and Sklash Mataka. So all these 10 herbs together when given, it produces the fortified effect to tackle down the effect of wish. So we have used this Vishagna Mahakashai. You see, Shireesha is there, Shleshmataka is there, Chandan is there, Haridra is there. These herbs are used in this Vishagna Mahakashaya also, and separately also we have used. For example, Panchashireesha ghee we have used, Shleshmataka fresh Swaraj we have prepared, to apply the paste. So this is Vishagna Maha Kashaya. This also 15 tablets thrice a day we have used in the patient. Next one is Kaishora Guggulu. We all are familiar with this Kaishora Guggulu. We use this in Kushta, especially when there is a clay yukta Kushta or kapha is more in Kushta. We use Kaishora Guggulu. Classically, it is indicated in Prameh Pidaka and all kind of Vran. Vran is all kind of ulcer. Then Prameh Pidaka. Important to note that there is a few types of Prameh Pidaka in Charak Samhita and Vidradi or the abscess, internal abscess or external internal organ abscess or external abscess. Charaka has counted as abscess in one among the Prameh Pidaka. So in this patient also abscess was there. Once it will be doing means after few days the whole collection will be accumulated in that area and we have to cut open and remove that this pus. So we can also take as Prameh Pidaka. So Kaishora Guggulu indicated in Prameh Pidaka and all kind of ulcer. So we have used this formulation in this patient. Now Dooshivishari Gulika, again this is from Ashtanga Hridaya Uttara Tantra. So this contains 12 these ingredients: Pippali, Dhanyamla, Chatamasi, Lodra, Ela, Suvartala, Natha, Kushtha, Yashtimadu, Chandana and Gairika. So this also helps in Dooshivishari. So main herbs. According to me, without this herb, we can never ever treat any kind of poisonous case. Let it be garvish or it can be animal originated wish, random wish or flower wish. Without Sireesha, it is next to impossible to tackle any kind of poisonous case. And to support this statement, Acharya Charaka has mentioned Shireesha as Vishagna in Agray Dravya. So Sireesha is best herb to be used in Visha. Treatment of any poison cannot be done without use of Sireesha. Here you can see the tree of Sireesha with a beautiful pink flower. There is one other variety which has a yellow flower also. This patient has had taken a fresh juice of flower every second hourly, 1 tablespoon of this fresh juice of this flower. Sireesha, again I am telling, without Series use, we can never ever tackle any case of poison. Series flower thrice a day. So we have used this combination to give a medicated smoke. The smoke was poured on this area where the lesion was there. In Charak Samhita, it is mentioned that Dhupana, this is in the general Dhupana. It is not exclusively mentioned for spider bite, but Charaka has mentioned general fumigation or medicated smoke, which is to be used in any kind of poison and edema. It contains Nata. Nata is Tagara. Then Kushta. Third ingredients Charaka has mentioned is we have to use head of a snake. Snake having two head. So we have to use the head of the snake. The snake which are having two head. I don't know which snake is having two head. I haven't used in this case. But Charaka in the same sloka has mentioned that along with Tagar, Kush and Shireesha flower, we have to use head of this snake. We haven't used the head of snake. Rest of all the herbs we have used. So it is called a Dhumagada. It cures all types of poison and edema. Sarva Vishagna Prayatur Hatya. So this is the Dhupana or medicated smoke we have poured on this affected area. Next is paste of Rakta Chandan, Sireesha, Bij, Nirgundi, Vidarikan, Tagar, Kush, Patala, and Anantamula. That is Sariva. So all the churna of this herb, Chandan, Sireesha, Nirgundi, Vidarikan, Tagar, Kush, Patala, and Sireesha, all this churna of this herb was taken, and fresh juice was extracted out from Sleshmataka leaf, and we have made a paste, and that paste was applied on the area where there was a lesion site, and also we have given this for oral use. Botanical name is written in this: Chandan, Padma, Kusir, Sireesha, Sindhuvarika, Shirvaluka, Tagara, Kushta, Patala, Uditya, and Sariva. So all this powder together with the fresh juice of Sleshmataka, application for the spider poison. Charaka hasn't mentioned that it has to be used for oral use. He has mentioned for external use only. But I have given this same yoga for oral use also to this patient. So treatment, all 8 modality I have finished. Next we will see the results. See, 24 this April, you can see the photo of the patient's hand. You can clearly see the inflammation or swelling is clearly visible. Full hand is swollen, and all the it is when you touch on that part, you feel it is like a stone only, very hard to touch and very hot. It is with increased temperature on the skin. You can see 24th April. Next is 25th April. After second day of treatment, a very light changes is there. Now you see that this 25 and 26, we can see the remarkable improvement in 26th. Next you see the 1st May. It is almost 80 to 90% recovered. The discoloration or the spider vein like this appearance was also reduced. The swelling is reduced. The pain was reduced. There was no fever on 1st May. So, and the patient came before 5 to 6 days just to show again. That time I have taken another peak, that is 17th of May. That is 100% healed. There is no symptoms, there is no pain. And important to note that without operation, he has healed this lesion. If this patient was continuing their track of medicine, then patient would have operated third time for this area, and after operating this area, I am sure it will go ahead. This is the results we got in 7 days of treatment. We have used all the classical medicine which was explained by Acharya Charaka and Acharya Vagbhata, and here is the results. Again, thousands of years of human observation and trial and error is more than 6 months of rat experiments in the lab. After seeing this case, we must respect our Samhita and Shastra. That is the only way to be successful in Ayurveda practice. Thank you.
So my question is, if a spider bites, how,
Yes, madam.
as a lay person, is there a way for me to know whether it's a spider bite or something else, as an allergic reaction?
See, the initial slide, I have explained how Charaka identified that we can see Damsasya Madhya Yet Pushnam Shavam Va Chalaka Avutam Dagda Akruti Dusham Paki Kled Shoth Jara Anvitam. So when we observe these symptoms in the patient, it is a pakka spider bite. See, the symptoms which Charaka has mentioned was clearly visible in this patient. It is simple. So the same lesion, this you are seeing, this is the initial. After 10 to 15 days, if this case is not treated, then we will be seeing a wound on this area. So if few days are passing, this appearance may be disappear and there will be a wound. When you Google spider bite photo, when you Google on the Google, so you might not see this photo. These are the initial symptoms. Updrava of this, complication of this. There will be a vrana, dushta vrana, nadi vrana. So this will be counted in complication. But these are the initial symptoms which must be observed in the spider bite these cases.
I would like just ask a question. So Varanadi Kashaya is also indicated for internal vidradhi. So how can we compare results of Kaishora Guggulu and Varanadi Kashaya in this case?
Varanadi Kashaya, I am not talking about classical reference and all. Varanadi Kashaya I am using where we have a fluid accumulation. It's already there in fluid accumulation. For example, liver abscess is there, sinus is filled with mucus, or cerebral abscess is there inside the brain, or pleural effusion. I think you are getting where the fluid accumulation is there. When patient is coming to you and it's already fluid is accumulated in any of the cavity, better to use Varanadi quartz or Shiguru quartz with Katali.
Okay.
When patient is coming, fluid is healed or it is not, abscess is still not formed, it is better to use Kaishora Guggulu. Once abscess is getting formed, we should remove Kaishora Guggulu and we should add this Varanadi quartz. In this patient, abscess is not there till now. If 10 to 15 days is passing in this case, then there will be a big large size of abscess. For this, he was operated twice in a past.
So we can use Kaishora Guggulu where we want to have an effect of Raktapachan also. No?
We can take like that.
Raktadhatu, yeah.
So is there a way like, as you said, Dr. Rajnikant, accumulation of fluid or abscess will be the indication for using Varanadi Kashayam. Can this both Varanadi Kashayam and Kaishora Guggulu be used in combination? Like if there is an abscess, for example, or there is a swelling with fluid in Luta Visha or a spider bite. first we go with Varanadi Kashayam, and after that, after the fluid discharge has taken place and the fluid compartment is clear, the swelling has reduced. Still, we should be using Kaishora Guggulu in the next stage of the treatment.
We can use, no issue, because this Kaishora Guggulu is classically indicated in, I have told, Prameya Pidaka and all kind of Vrana. And Charaka has counted Vidradhi as one among the Prameya Pidaka. Why I am more putting weight on Varunadi Quat for FC because in Ras Tarangini, that is Ras Shastra classical text, they have mentioned Varunadi Quat exclusively for Abhyantar Vidradhi. And both together also can be used. In piles is the, fistula tract, anorectal fistula, I use both Kaishora Guggulu and Varunadi Quat at the same time.
I have a question of the Aushadha Pachan. If we give Aushadha in the high doses, so what about the Aushadha Pachan, sir? Please explain.
Will see, we have given the high dose of medicine, we have got the results. So Aushadha Pachana is done, then also this result is coming. Na? In the serious or in emergency or in critical condition, I think if we are looking for Dipana and Pachana and Langana and all, patient might die. If patient is coming in this type of condition where we expect results in second or third day, we should not go for Dipan Pachan and everything all. If you take 7 days for Dipan Pachan in this patient would have gone for operation. Another point, we are using all this medicine. It contains Musta, it has Haridra in it, it has Shunthi in it. So by default, there will be a Dipan Pachana. Is it clear or not?
Okay, sir. Thank you. Clear.
Okay, thank you, Akankshaji. So one more question, I think, from Kalpana ji here in the question box. Seems like very slow spreading poison. How long ago the spider bite happened? Any idea about that, Dr. Rajnikant? How long ago the spider had bitten? And it looks like a slow spreading poison. Is it slow spreading or fast spreading, Luta Visha?
Slow. It is, you see, in this first discharge summary of the hospital, it is on 14th of February. So before 7 to 10 days of this MRI, patient had developed the same feature. Wish you may take because it is slowly spreading. It is 3 dosha involved in it, but cough is more because at the end, after 10 to 15 days, the large size abscess or too much clay is getting accumulated. So cough wish is there, I think.
Were the modern medicines continued while you were treating this patient, or they were totally discontinued? How was it?
Patient was taking this modern medicine for the wound here. It was not healed. Second operation wound. For this, he was taking some antibiotic and some external application.
They were continued while you were treating them?
It was continued. So
Okay.
you were taking since 1 day for second operation. It doesn't help us.
Okay, so was it dealt as an inpatient or an outpatient approach for this patient?
Outpatient only.
Outpatient only. So in outpatient conditions, Dr. Rajnikant, of course we will get the patient under our confidence. They trust Dr. Rajnikant or whoever is treating the patient. But taking the medicines in such large doses and continuously monitoring. So because, as you said, you had a very short time to deal. So because if that doesn't give result, they were ready for surgical process. How did you convince them to take so many medicines? And is it the patient's agreement that I'll take the medicine, or did you get somebody else into confidence? So it becomes very difficult to give and also monitor. In patient, it is okay. We can monitor whether the patient, because we will be giving the medications and constantly monitoring. What about when the patient is at home?
Normally, patient come to me, they will by default ready. He will give this much medicine because, and if they are not ready also, then we should make them understand that these are your condition. For 5 to 6 days, you take this high dose medicine, and if after 4 to 5 days you are not getting positive improvement, then you can choose what to do. So patient will be ready because 2 times he had done operation, and for 3rd time he wants to prevent. But if 5 days we are getting results, then only I will hold the operation. Otherwise, I am ready to go for 3rd operation.
Yeah, that also I had a doubt, Dr. Rajnikant. You said the 3 times the patient had similar symptoms in the past, and you also said that 2 times before this.
Yes.
And the spider is not native of Gujarat, like it is not found in Gujarat, and it might be in a container which has come from China or somewhere. So it was like that. But how did the same person get exposed to, like every time he gets a contingent or something containers from China or somewhere? So would he find spiders, or did he take some caution? How did the same spider, which is not native of Gujarat, did he encounter? So our question number 2 is, did you see similar?
It is still a secret, but 99.99%, this is the only spider which is responsible for this boy's condition. Because the surgeon who is doing dressing for this boy, I have already mentioned the fluid accumulation in the wound, or when they cut open the skin and they see the dead tissue beneath the skin,
Right.
it is seen in the insect bite patient only. It is not a normal cellulitis. It is not a normal phlebitis. It is the cellulitis which is seen in any kind of insect bite. One is this evidence. Second evidence is that patient has seen this spider in his shop.
Did he also see the spider on his body, like moving on his body and giving a bite?
It was like this much size spider. It might came with any contact with sari, and you see in the photo the spider having a sharp thorn in all his leg. So he might be releasing some kind of poisonous thing on this cloth, and the cloth he has taken on this, and he has transported the cloth, and that must be touch here. So this is my this hypothesis.
Yeah, it may be due to contact with the cloth on which the spider was there, rather than the spider directly.
No, yes, correct.
But who took this photograph, Dr. Rajnikant? I was interested.
Patient.
My question
Thank
is,
you,
sir, what is the role of Dhupana, sir, in this
See,
context?
some things in Ayurveda where the mind of 21st century human being cannot think over that. There is a many thing mentioned in Ayurveda where Acharya Charaka has told that this topic is achintya. We should not think about this because the mind of modern human beings is not capable to think deep enough to understand the subject. When we want to think that how Dhupana is going to affect them, because skin is closed, it is not open, but still it is in mucormycosis also. I have told Dhupana is Ardha Chikitsa and treatment of mucormycosis.
Sir, sometimes patient has Pitta Prakriti and they could not tolerate the higher doses of drugs like Dooshivishari Gulika and some other drugs. So in such condition, how can we modify the management?
We can tolerate Dooshivishari Gulika, no issue. Vilvadi Gulika is there, it means Ushna. I have find some difficulty for Vilvadi Gulika. Dooshivishari, no issue, I think.
So can we add other drugs like that helps to balance Pitta like Kamdudha and Avipattikar and all?
Definitely. But in such cases, when you have 4 to 5 days or 2-3 days times, we have to use all our weapons.
Yeah.
Just to see the results after 24 or 48 hours. If after third day of our treatment, patient is not seeing any positive improvement, then they will go for surgery.
Yes.
So in this case, you said that the patient was, going for surgery for the third time.
Yes.
So you had then gone ahead and done an aggressive treatment. If the patient did not have to go through the kind of surgical treatment, would you have gone with a less aggressive treatment?
Of course.
And stretched over a period of time, and for how long would that be?
See, in this, so after patient has only 7 to 10 days after appearance of the symptoms, and he has to get operated. Otherwise, it will damage the bone and cartilage beneath the skin. Fluid will be accumulate like that much only. I have many other reports also. I will share you personally. So it is only time for 7 to 10 days. If 7 to 10 days it is not handled, then it will damage the skin and ligament and tendon. I think you are getting or not?
Yes, so that means you just you had no choice but to go through the aggressive treatment, irrespective of whether the patient was going for surgery or not.
10 to 50, maximum 10 days. Otherwise, it will be very bad wound will be formed. and it will be another then difficult. I think no, aggressive is only the answer for this case.
So the
Yes.
question is still, would you have gone with an aggressive approach? Like there was a small window period through which you would have treated. So that was a courageous decision on your part to implement the treatment in whatever small time available. Wait and watch. So that still is an experiment. What we are trying to do on the patient. Wait and see if it doesn't yield result, we will go to the surgery.
Yes.
So if it weren't the case, if the patient would have come at the first instance itself, not at the third time, but at the first instance itself.
That will
Would you
be
still,
aggressive.
yeah, would you
Because we
still have gone
don't
with the aggressive?
it is taking to manifest big size of disease. So of course, normal treatment we will be doing.
So while dealing with these type of cases, there are more precautions we need to take as Ayurveda practitioners, other than making them understand the kind of treatment and all. Are there
And we
any
make
kind?
we take a signature is consent form.
Okay. Are there any kind of paper procedure? That was the next
Yes,
part of.
yes,
Okay.
we always take a consent form for all the Panchkarma procedure and all these kind of cases where anything can be happened in next day. In OPD level also, we take a sign signature in consent form.
Did the patient, this Luta Visha patient, had a preliminary knowledge of Ayurveda and Ayurveda treatment? How did they come to you? Number one, and why did they even want to wait? So because that person has experienced already twice, why did they want to wait and take the Ayurveda treatment, and what happened there? So what was your role?
There was my patient of mucormycosis who was saved by myself. His father and this patient met, and his father explained that my son is having this kind of issue. 2 times he has operated, and we must go for operation after 4 to 5 days. So he advised to come to me that one of my patient of mucormycosis. So I think they were ready to take Ayurveda treatment.
Thank you there, Dr. Rajnikant. One more question by Joe Merenji. Is the spider shown here a brown recluse which is greatly feared and common in Florida? So US in area on this?
Oh, so you're saying this is very common in Florida, USA, right?
Yeah, is it the same spider?
It might be. It is what I told. When the photo of this spider, the patient had some relative in USA, doctor only. They have sent all the culture sensitivity MRI report and this spider report. They have told it is a pakka this spider bite case only, and it is not locally seen in Gujarat. That is what they have found. So this must be 99.99%. It would have come from China in this shipment.
So like what if the patient doesn't know that it is a bite? So here the patient at least had an idea. So here there are two questions. So what if the patient has not seen the spider at all, or doesn't know that it is due to the spider, and the physician, because the Visha Chikitsa is one of the least focused chapters in Charaka Samhita or anywhere. So probably for passing examination, students would have read. So, but those who are dealing with Visha Chikitsa, they might be knowing, but all physicians will not be knowing. So when this patient comes with those things, the physician may think it is a kusta or a shota and go with some treatment, accidentally still using Kaishora Guggulu and other medications, not of course the medication or the line of treatment that you have used. So what if this happens? The patient doesn't have the knowledge of Luta Visha, so they cannot explain it to the doctor. Suddenly they come with the symptoms, and the doctor also is not in a position to identify that it is a Luta Visha. How does the doctor handle it? What are your tips?
So if we see the sloka of Charaka, Acharya Charaka, maximum in this we can see the Jwara is there, Pitta Kapha symptoms is there, Paka is there, Kled is there, Swatha is there. Then this spider vein like appearance is there. So if the patient doesn't have any knowledge of the spider and directly coming to us, then I would have approached with aggressive pitta treatment in this case. Along with Kushtikita, we can I must have used a Varanadi Kashaya and Kaishora Guggulu together in this, because when we touch his arms, it is a very hard. So it suggests that the pus is getting formed there. So I would have treated with aggressive treatment also same, but Pitta treatment also only I will be giving in this case. If after 15 to 20 days patient is not getting a relief, then I will open the book. Then I will get this is a spider bite case. Then again I will shift to this.
Okay, so when we don't know the cause, Nidana is not tracked down, we should be using Upashaya and Upashaya method only and try to use the Yukti there. So like a Shota Chikitsa, because cellulitis is there and other line of treatment shall be used. Sadhanaji wants to know were Roga Bala and Rogi Bala taken into consideration in this case. Number one, person is young. Did that really help in the cure? Also, Rasaushadhas are known for quick cure. You chose Kast Aushadha mainly. Can you please talk about your thought process?
Actually, Aushadhi fan, big fan, diehard fan of Rasa Aushadhi. But what I did in this case is, this case came to me in morning. I have, because patient pakka for spider bite, I haven't given treatment on the same day. Next day I have started treatment. The day I have read the Charak Samhita and I plan to treat based on Charak Samhita only, because the best in-depth description about Vish, either Sthavar or Jangam, is explained by the Acharya Charak Samhita from any Rasa Shastra author. So this is the first reason. And so I have chosen you see all the 8 modalities. From 8 modalities, 7 modalities are from Charak Samhita. Dooshivishari are from Ashtanga.
And Rogabala and Rogibala, were they taken into consideration was another question by Pradnaji. And the age of the patient, did it help?
Yes, definitely. Because Rogbala is more, Bogibala is also good. So patient was able to take all these dose, all these 40, 50 tablets together at a time. They were following everything which I was telling. They were sending photographs daily in the morning. Young age help. This might help this patient to recover fast. If same case in old age or middle age after 35, 40, then it might be difficult for them to take this much medicine and do all this fumigation and external medicine, because all day they will be busy in this treatment only in these 7 days. Every 2 hourly he has to take Shireesha juice thrice a day. Thrice a day they have to take medicated smoke on that area. So yes.
So my question is to you, sir. First of all, that when patient arrives to us, they come with reports, like a certain stack of reports from allopath, certain examinations. So before proceeding, what should be our approach? Should we go for the reports in such cases, or just on our literature work, our references of these Vaidyas?
Definitely, we should use modern science for investigation purpose only, not for medicine. See, simply patient is coming with discoloration on the skin and some pain, then we won't go for any report. If this patient is coming for first visit to direct Ayurvedic hospital and there is a severe, too much fever is there, severe swelling is there, severe hardness is there, then we must go for at least local USG. Local USG will suggest that it is what kind of growth is there. So doing investigation is must in such cases. But same patient coming with just discoloration and spider vein like this and simple pain, then we should not go for reports. It depends on what critical condition patient is coming.
Okay, sir. So in this case, did you made all the diagnosis and this treatment procedure as a part of your examination with addition the treatment findings, or I mean the observation from the reports? So that was your approach, I mean, while getting to this treatment?
Saying, see, I have already mentioned. See, you see the two discharge summary of two operations. In diagnosis, they have not mentioned it is a case of spider bite. You see, first
Yes,
operation,
they didn't
right
mention,
side
right?
cellulitis with superficial thrombophlebitis. In second, recurrent right forearm cellulitis. They haven't mentioned this. This is a spider case, right? But based on patient's history and based on appearance and based on what Charaka has advised, patient had similar this thing. So I have started on this Luta Visha protocol.
Okay. Yes, sir. I got that.
Rajnikant sir, this is little bit apart. If in a scorpion bite patient came for an Ayurvedic physician like us, what will be the first line of treatment or what we can able to do in our practices, day-to-day practice?
Shireesha should be available in plenty of number in our area. Shireesha tree should be must in every city. If you don't know anything in any kind of bite, if it is a snake bite, if we are in peripheral area, right? We find this Shireesha flower. You apply the paste of Shireesha flower and give Shireesha flower for chewing continuously till he arrives this thing can be done. One more thing, cow ghee. The Ghritha is to be told as Vishagna, Suvarna is to be told as Vishagna. So Shirish, cow ghee and Suvarna. These three is must for Vish Chikitsa. Suvarna
Thank you. Sir,
ghee and
please.
Shireesha can be made available. So we should use Shireesha as much as possible. See, Panchashireesha Gritha, Charak Samhita, Charak Acharya also told it is best to be used in any kind of poison. Shirish Panchaka ghee that I have prepared and we are using in the many Garvish and Dooshivishari cases. Shireesha is the answer of your question, sir.
Yes. Thank you, sir. Thank you so much.
Thank you, Karim sir, and thank you again, Rajnikant sir. And Vasanta madam has one more question there. So in the box, like with so many medications being taken, were there any toxicity issues or adverse events like vomiting, etc.? Dr. Rajnikant?
Never. Not in this case. Rarely I find such complaint from patient that this much medicine I am taking, I am getting like this. Rarely this complaint arises. Question comes. For this patient, no complaint was having.
What if Shirish is not available in the region? So and immediately we need it, but it is not available.
First priority is for Shirish. Second one is Tagar. Tagar we generally use for sedation and loss of sleep. Ayurvedic doctor Tagar we tell means they will tell it is best to be used for a loss of sleep or anidra. But Acharya Charaka has mentioned, has taken name of Tagara plenty of times in Vish Chikitsa. Even single herbs use also he has mentioned Tagara to be used in any kind of poison treatment. So Sireesha is not available. Tagara in raw form might be available everywhere because it is a common herb like Sunchi, Guruchi, like that. If anything is not available, we should give 100 ml of Ghritha, cow ghee at a time. Ghee should be available in India.
Okay, since there was also a question by Pradnyaji about Rasaushadhas, if you would prefer couple of Rasaushadhas in this particular condition as an emergency, what medicines would you use?
It is, by seeing the axis and all, I would have used a Shuddha Kajali in Varanadi Kwath or Shigrut Kwath. And for Pitta, Kamdudaras is there. Definitely.
I just want to ask Lepa and Dupana, what was the spacing? Like you did Dupana after Lepana or Lepana after Dupana?
After Lepana, I have advised Dupana because applying the medicine might open up this pouring in the sweat gland or so the smoke would have effect more. So first is application. After removing and cleaning the area with warm water, Dupana was given.
So what was the spacing? Immediately you would do that or would you give
Lepa is removed, wash the area, start the Dupana.
even coming to these daily rituals like snana and all those things, what would you advise? What would you advise the patient to do, like taking a bath and other conditions, and also the food restrictions, anything? So taking bath, so like with water, hot water or cold water, what would you advise? Or a medicated water, Shireesha Siddha Jala or something like that?
In this case.
In this case,
Diet in general diet I have advised for which balance all the three dosha and about Shireesha powder for bathing I haven't advised in this case.
okay,
Normal.
bath they can take. Any specific indications and contraindications in diet?
Visha is Ambu Yoni told by Charak Samhita, so we should avoid any food item which forms the cleda inside the body. Like too much water, fruit juice is there, curd is there, ice cream, cheese, butter, paneer. We should not advise any food item which creates or which do abhishandi or which increase the kled guna in the body. Because Visha is ambuloni. If more kled is going inside the body, then Visha will enjoy in the body. Will get nourishment. So we should cut down this kled.
Coming to this Maha Kashayams and the other preparations, Maha Kashayas, couple of Maha Kashayas you have explained. Are you preparing all by yourself? So like, are you monitoring the preparation also, or are you getting them from somewhere?
I'm not preparing by myself, but of course I do monitor the preparation. This kind of medicine we prepare in very small doses. We have some friends who prepare like this. Panchashireesha ghee I have only formed. I myself have prepared Panchashireesha ghee.
Apart from this condition, where else do you use Panchashireesha Gritha?
Panchashireesha we use in diabetic gangrene. We also use in this septicemia cases. because the bacteria, virus, and fungus all we take as Visha only. In mucormycosis presentation, I have used Dhupana of Varanadi Gulika. So in considering fungus as one kind of wish, effect of this is a wish.
Yeah, Panchashireesha Gritha, Dr. Rajnikant. Do you use it as a Shamana Sneha?
Sneha,
Like-
not because of use of this series ghee while using.
Okay, so my question was, do you use the ghee for internal consumption, right? Like Sneh
Yes,
Pana
in
in small doses?
consumption, and while giving Dhupana, I used to pour half tablespoon of. I have already mentioned it this presentation.
Right.
The Dhupana, in that also I have advised them to put little bit Panchashireesha ghee in Dhupana.
Okay.
So it might have fortified the effect of this Dhupana.
Okay. So my question was, is it used during the process of treatment wherever you use Panchashireesha Gritha? Is it in the Shamana as a Shamana Sneha? Do you use?
Yes, low dose regular. Yes, no, not in the not for the this Shothagna or like
Not for
that.
the Shodhana Prakriya. Okay, thank you, Dr. Rajnikant. Thanks for your wonderful talk, inspiring talk, and also the presentation on Luta Visha, a very rare case and phenomenon which we come across. Thank you. So we will take leave from this particular session until we meet another GURUBODHA session. So namaste and thanks to everybody. Namaste.